Okay, this is part 13 from my book, Prevent and Reverse AFib by me, Pete Rogers. We're talking about medications that are associated with increased risk of drug-induced atrial fibrillation. Continuing on now here, there's over 100 of them. Where cardiac ultrasound, contrast agents, perflexane, perfluorobutane, anesthetics like bupivacaine, local anesthetic, drugs for premature labor, hexoprenaline, terbutaline, other medications that have unknown mechanisms, like some of these osteoporosis drugs, like the bisphosphonates, Fosamax, zolendronic acid, ergonovine. Okay, and some of these other unusual drugs here: fluorescein, icosapent ethyl, lacosamide, anti-epilepsy drug, marijuana, cannabis. Marijuana is a very dangerous drug. I recommend you stay away from it. Those people who try to tell you it's a good thing, they're a bunch of idiots. I always try to run out of the room when I start listening to one of those idiots. They don't know what they're talking about. I've seen really severe complications from marijuana, including schizophrenic breakdowns, treated with those antipsychotic medications, and the patient getting a lobotomy. Okay, a chemical lobotomy. It's not a joke. It's serious stuff. They're also estrogenic. Ondansetron, anti-emetic, anti-vomiting drug, opioids, including tramadol, hydrocodone. A lot of strange meds here: alizapride, benzoquinamide, amifostine, disulfiram, like the anti-alcohol drug, flupirtine, gallium nitrates, levocarnitine, niacin. Everybody knows niacin. Omega-3 fatty acid supplements. How do you like that one? Increased risk of AFib with omega-3s. That's why I laugh when somebody tells me, oh, that's going to lower your risk of dementia. Right. Feeding somebody fat with a high rate of rancidity, lipid peroxidation, increased risk of AFib, increased risk of obesity, weight gain. Not a good combination. Increased risk of prostate cancer. Okay, amphotericin B, antifungal, calcium supplements. I think they're prothrombotic in high amounts. Okay, a couple more medicines. Some of these anti-clotting medicines, including clopidogrel, diclofenac, NSAIDs, ibuprofen, naproxen, NSAIDs in general, in patients with asthma and COPD in particular. Paracetamol. And by the way, there's more drugs, especially in the chemo and autoimmune categories. If I typed all of them, I would get carpal tunnel syndromes. I think that's about all I got, though. The bottom line is, if you're on drugs and you get AFib, consider it could be a drug, because maybe stopping that drug could help you to get better, so you don't have to go through, all the other agonizing stuff. So, anyways, that's it for today. Hope you found that helpful.